Here's a shocking reality. America just witnessed its most devastating measles outbreak in 3 decades, and it happened right in our backyard. The West Texas measles crisis that left families devastated and communities divided has finally been declared officially over. But the aftermath reveals uncomfortable truths about public health that many prefer to ignore. After 42 consecutive days without a single new reported case, Texas Department of State Health Services officials made the long-awaited announcement this Monday. But here's where it gets controversial. This declaration of victory comes only after an outbreak that exposed deep fractures in our communities regarding vaccination choices and personal medical freedom. The comprehensive response effort that finally contained this health emergency involved an intricate web of testing protocols, targeted vaccination campaigns, continuous disease surveillance, and extensive public education initiatives. Dr. Jennifer A. Shuford, DSHS Commissioner, acknowledged the monumental effort in her official statement, praising healthcare professionals who found themselves treating a disease that most had only read about in medical textbooks, never expecting to encounter it in their own practice. The timeline of this outbreak reads like a medical thriller that began quietly in late January within the small community of Seminole. What started as isolated cases quickly transformed into a spreading wildfire of infection that refused to respect county lines or state borders. The disease's relentless march eventually contaminated more than 10 Texas counties before jumping to 3 neighboring states, Kansas, New Mexico, and Oklahoma, and even crossing international boundaries into Mexico. By August 18th, the devastating toll had become undeniably clear. 762 confirmed measles cases across Texas alone, with children representing more than 2/3 of all infections. The human cost proved even more heartbreaking. 96 individuals required hospitalization for serious complications, and tragically, 2 young children from Seminole lost their lives to this preventable disease. And this is the part most people miss. The vast majority of those who suffered from measles had not received vaccinations. This fact alone has ignited passionate debates in communities across the affected regions, with families on both sides of the vaccination discussion feeling vindicated or defensive about their choices. The financial burden of this outbreak response exceeded $10 million in state resources, representing one of the most expensive public health emergency responses in recent Texas history. However, state health officials emphasize a crucial point that makes many people uncomfortable. Declaring this outbreak over doesn't mean the measles threat has mysteriously vanished from our communities. The measles, mumps, rubella MMR vaccine remains the gold standard for protection against this highly contagious respiratory virus, demonstrating remarkable effectiveness by preventing more than 97% of measles infections when administered in the recommended 2-dose series. This statistic represents decades of scientific research and real-world evidence, yet it continues to be a source of heated community discussions. Here's something that might surprise you. Even among the small percentage of vaccinated individuals who do contract measles, the symptoms typically present as significantly milder, and these individuals are substantially less likely to transmit the disease to others in their community. This phenomenon demonstrates the concept of vaccine breakthrough, which, while rare, provides important insights into how immunization works in real-world scenarios. But here's the million-dollar question that's dividing dinner tables and school board meetings. How do we balance individual choice with community safety? The Seminole outbreak didn't happen in a vacuum. It occurred within specific communities where vaccination rates had declined, creating pockets of vulnerability that the measles virus exploited with devastating efficiency. What makes this situation even more thought-provoking is how this outbreak has forced conversations about health equity access to healthcare, and the role of government in public health decisions. Some argue this crisis could have been prevented with better education and healthcare access, while others contend that heavy-handed public health responses infringe on personal freedoms. The ripple effects of this outbreak extend far beyond the immediate health consequences. Families have been torn apart by disagreements over vaccination decisions. Schools have implemented new health policies, and healthcare systems have had to reassess their preparedness for diseases once thought eliminated. As Texas communities begin to heal and move forward, one question remains. What lessons will we actually learn from this experience? And will they be enough to prevent the next outbreak? The answer to that question might depend on whether we can have honest, respectful conversations about the complex intersection of personal choice, community responsibility, and public health. What's your take on this? Do you think the state's response was appropriate, or did it go too far in restricting personal freedoms? Should communities with low vaccination rates face different public health measures? Or does that create a dangerous precedent? Share your thoughts. This conversation affects all of us, whether we realize it or not.